Good morning, good afternoon, and good evening. I'm so grateful that you all could join us from your living rooms and home offices across the world. My name is Kayleen Ressler. I'm an education advisor with USAID, and I'm also co-chair of the research task team of the Global Working Group to End School-Related Gender-Based Violence. So welcome to the webinar this morning. Hopefully you're all in the right place. We'll be talking about using data and evidence to understand the gender dimension of school violence. Hopefully folks can hear me. Let me know if there's any issues with the audio. I'll start with a little bit of webinar logistics. I imagine that you guys are all experts in virtual meetings at this point, but I just wanted to let you know that you have all been muted. So if you have any questions or concerns as we go along, please do enter them into the webinar chat. This webinar will be recorded, and we'll be sharing the recording and the slide deck afterwards. So don't worry if you drop off or miss anything, you'll have access to that later on. Thanks, and to kick us off, I wanted to turn it over to my colleague at UNGAI, Taku Kanyangarara, and she's going to provide some more details on the Global Working Group to End SRGBV and UNGAI's new learning series. So Taku, turn it over to you.
Thank you, Kayleen. So on behalf of the Global Working Group to End School-Related Gender-Based Violence, thank you all for joining us today. Since 2014, the working group has provided a platform for more than 50 organizations working on education, child protection, gender, and health to advance on ending gender-based violence in and around schools. The working group is co-chaired by the UN Girls Education Initiative and UNESCO. As part of our work, we promote the generation and sharing of knowledge, evidence, and standards of response, and have recently launched a learning series. The learning series is designed to dig deeper into the data, programming, and research highlighted in 6 thematic briefs that we launched in December 2019. And today's webinar is actually the first in the learning series and draws on the thematic brief on data and evidence. We'll share the links to these briefs following the webinar, but I just want to reiterate our appreciation for your participation, and we look forward to hearing from you and the panelists.
Great, thanks so much, Taku. Before we get started, I just wanted to note that much of the research and the planning that went into this webinar happened in a world that looked quite different from the one we're living in today. We recognize that currently over 1 billion children are out of school across the globe, and the threat of school violence may seem a bit overshadowed by some of the other safety risks that children are experiencing right now, violence in the homes, in the communities, and online. But we also want to acknowledge that the root of this violence across all of these spheres often lies in discriminatory gender and social norms and unequal power dynamics, and that by addressing those at the household, school, and community level, we can prevent violence in all realms of children's lives. So much of the research and findings that will be shared today are still very relevant in today's education climate and will provide us with new insight for our programming as schools begin to reopen. I am going to just introduce our panelists and quickly walk you through today's agenda. First, we're lucky to have Chrissy Hart of Together for Girls, who will be presenting on their multi-country analysis of the Violence Against Children surveys. And her presentation will highlight the gender dimensions of their findings and the role of data in advocacy work. Next, from the Population Council Girls Center, we have Stephanie Saki and Meredith Kozak, and they will be presenting their brand new tool, the Evidence for Gender and Education resource, or EGER tool. And specifically, they're going to demo how to use this tool to find relevant programming and data on SRGBV. And finally, we're lucky to have Shirley Miske of Miske Witt Associates, and she will present their approach to measuring the whole school minimum standards framework and findings from their recent baseline assessment in Zimbabwe. After that, we'll be able to open it up for discussion and Q&A with the panelists. All of our Q&A will be through the chat box, so feel free to enter any questions as we go along, as they come to your mind, and we'll revisit those at the end. And again, if you're having any issues with audio or connection, let us know in the chat box, and my colleagues Jada and Gloria can help troubleshoot as needed. So again, thanks for joining. And with that, I will turn it over to Chrissy.
Thank you so much, Kayleen. And big thanks to you and to Jada, Gloria, and Taku at Ungai for your efforts in organizing the conversation this morning. So good morning or good afternoon or evening for those joining from other time zones. My name is Chrissy Hart, and I serve as Senior Advisor with Together for Girls. In my role, I lead our work in Sub-Saharan Africa and manage aspects of our research and advocacy work, including our work on school-related gender-based violence and the collaboration I'll be talking about today. Oh, sorry, can we go to the next slide, please? Sorry about that. Which is a collaboration with USAID, the Aid Data Center for Development at the College of William and Mary, and the US Centers for Disease Control and Prevention, or CDC. So by way of a brief introduction, Together for Girls is a public-private partnership between national governments, including the US, Canada, and 23 countries where violence against children and youth surveys have been or will be completed. UN entities, including UNICEF and the World Health Organization, and private sector organizations. We work at the intersection of violence against children and violence against women, recognizing the profound connection between the two and the need for coordinated responses. We pay particular attention to adolescent girls because they often remain invisible or fall through the cracks in the development of policies and programs to end both violence against children and violence against women. So briefly, just to summarize our model, we take a three-pronged approach to prevention and response to violence against children, consisting of data, action, and advocacy. Data guides the way. We work with governments to implement national surveys led by the US Centers for Disease Control and Prevention as part of our partnership to document the magnitude, nature, and impact of physical, emotional, and sexual violence against children and youth. This data helps policy and decision makers, communities, civil society, and donors to take an evidence-based approach to generating political will and guiding effective policies and programs, as well as resource allocation for efforts to prevent and respond to violence against children. To date, the VACS have resulted in 9 national action plans with several more in development. Finally, we work with partners to engage in targeted and strategic advocacy and communications to raise awareness of the issue, improve data use for effective action, and help set global and national agendas. So we currently work in 23 countries with national partners that have implemented or will implement a VACS, including across Sub-Saharan Africa, where the majority of VACS countries exist, Latin America and the Caribbean, Southeast Asia, and Moldova. So just to quickly summarize the VACS methodology, the VACS are household surveys, they're retrospective, and they are conducted among 18 to 24-year-olds. At the country level, the implementation of a VACS is led by the national government, with CDC providing technical support. UNICEF often provides support and coordination. And this approach ensures that the VACS are embedded in national structures and nationally led. Extensive efforts are taken to protect respondents, including the implementation of a GBV response plan for the identification of acute cases of violence in the course of the survey implementation. And in relevant countries, HIV testing and counseling are administered in conjunction with the VACS for respondents who can receive results on their own. Finally, the VACS results are published in national reports, as mentioned, and these can be found on our website. Topics covered by the violence against children and youth surveys include demographic data, including socioeconomic status and education, the prevalence of physical, sexual, and emotional violence, and the perpetration of violence, gender attitudes as they relate to violence, health risk behaviors, including risk for HIV infection, physical, mental, sexual, and reproductive health outcomes, including unintended pregnancy, and disclosure and service seeking, as well as service receiving. So now I'll turn to our research focused on school-related gender-based violence, and this has really been a project in the works for about the last year and a half. So I'll frame the presentation of the findings by sharing UN Women and UNESCO's definition of school-related gender-based violence from their global guidance to address SRGBV. So SRGBV is comprised of any act or threat of sexual, physical, or psychological violence occurring in and around schools perpetrated as a result of gender norms. SRGBV violates children's fundamental rights, is a form of gender discrimination, and has wide-ranging consequences for children's physical and emotional well-being, school performance and attendance, and the likelihood of experiencing or perpetrating future violence. While our research reinforces that school environments can enable violence, we emphasize that they can and should be viewed as protective spaces for children and an arena for broader social change to end violence both inside and outside of the classroom. So just some brief background on the project. The project is supported through USAID's Higher Education Support Network, and the Aid Data Center for Development has and continues to conduct secondary analyses of the VACS to identify the prevalence of SRGBV, as well as details on violence perpetration, victimization risk, and post-violence behaviors in selected countries. CDC is a technical partner on this project, and Together for Girls' role is to translate the data and findings for an array of audiences to inform conversations at the national, regional, and global levels. So the methodology, the secondary analyses considered 7 VACS data sets from Honduras, Kenya, Malawi, Nigeria, Tanzania, Uganda, and Zambia, utilizing cross-sectional regression analysis techniques. And the key research questions that we asked include the following. So the national prevalence of SRGBV, whether boys and girls are experiencing similar rates of SRGBV, whether boys and girls are likely to experience one form of SRGBV, how SRGBV affects rates of school absenteeism for boys and girls, and the patterns for disclosing incidents of SRGBV and seeking or receiving services. And in terms of limitations, just a few things to mention, that while the VACS do tell us more about violence in schools than any other widely applied survey, they are not explicitly focused on educational settings or SRGBV. And as a result, the SRGBV estimates that I'll present here may not be fully representative of the spectrum of forms of SRGBV that are experienced by students. And just to note that while Kenya and Tanzania were part of the analysis, because the surveys were older than the 5 other countries, they didn't provide sufficient data to produce overall estimates of SRGBV. So now to the findings. This graph displays findings for overall rates of gender-based violence among survey respondents who had ever attended school and experienced one or more forms of sexual violence or physical violence perpetrated by classmates or teachers. So you can see that there's a significant variation in prevalence by gender. Uganda has the highest proportion of students experiencing SRGBV, with 54% of male students and 45% of female students, while Nigeria was the only country where female students overall experienced higher rates of SRGBV. And just to put these percentages in proportion, based on World Bank population data from the years that the VACS were conducted, the numbers for Uganda represent about 4.5 million students in sum, and the Nigeria data represents about 13.5 million students. So these graphs represent physical violence perpetrated among students. We found, unsurprisingly, that males overall were likelier to perpetrate and experience physical violence, and that female students were overall much more likely to experience physical violence at the hands of another female student. Next slide, please. And then in terms of school absenteeism as a result of physical violence, we found that peer violence in schools resulted in high rates of absenteeism, and that girls generally experienced greater rates of absence because of the experience of physical violence. In Uganda, nearly 30% of students experiencing physical violence at the hand of a peer missed school as a result of that experience. Now, turning to the prevalence of sexual violence, we found that Malawi was the only country where female students reported experiencing significantly more sexual violence perpetrated by a classmate. And because of the way the question is asked in the survey, this indicator is not disaggregated by the sex of the perpetrator, only by that of the victim. And rates of sexual violence perpetrated by teachers against students were lower overall, but girls were consistently at least twice as likely to experience sexual violence at the hands of a teacher than males. Next slide. So now I'll turn to some specific findings that summarize questions about physical violence perpetrated by teachers, which we've decided to brand as corporal punishment overall. So these graphs show the prevalence of corporal punishment perpetrated by teachers against male and female students. While we weren't surprised to see that male teachers perpetrate more corporal punishment overall, it was really interesting to note the higher risk for corporal punishment at the hands of a male teacher for all students in Zambia, Uganda, and Malawi, and then the opposite dynamic in Nigeria, which really reinforces the idea that robust data has a huge impact in elucidating these complex gender dynamics to ensure that SRGBV prevention and response efforts are as responsive to the context as possible. And one thing I want to note is that while gender attitudes weren't included in the secondary analyses, the VACS does include a question on attitudes around gendered violence. So in Uganda, for instance, the country with the highest rates of corporal punishment, half of 18 to 24-year-olds, so 57% of females and 48% of males believe it's acceptable for a man to beat his wife. This underscores what we understand about gender and corporal punishment as a mechanism for the reproduction of inequitable gender norms in and beyond schools. And this has a bearing on educational outcomes and attrition in school attendance, as well as physical and mental health outcomes, particularly among girls, but certainly for all students. So we're currently producing a policy brief on gender and corporal punishment that will take a look and do a deeper dive into some of the legal frameworks and some case studies of best practices and promising approaches at the country level. And then returning to the issue of school absenteeism, absenteeism as a result of corporal punishment among the 4 sub-Saharan African countries varied from about 1 in 10 to 1 in 4. And in Honduras, we didn't include this in the prior slide, but corporal punishment has been banned since at least 1996 and arguably since the 1920s. But only 1% or less of both boys and girls reported experiencing corporal punishment. But I think it's notable that over half of girls and 1/3 of boys who did experience corporal punishment reported missing school. And this is really reinforced by recent reports from UNICEF that severe forms of corporal punishment are still implemented in Honduras, notwithstanding the long-standing ban. So next slide, please. And the last topic I'll turn to is disclosure and access to services. So I've taken examples here specifically from Nigeria. The analysis findings from Nigeria demonstrate that while very few students are disclosing experiences of physical violence, almost no students are seeking or receiving them, indicating a major gap in information about and also confidence in seeking services. The findings were very similar for Zambia and Uganda, while disclosure rates were actually under 10% for both Zambia and Honduras. And sorry, this was for experiences of physical violence. The next slide demonstrates rates of disclosure, service seeking, and service receiving for students reporting experiences of sexual violence. And you can see these are abysmally low. So now just to sum up a few takeaways and next steps. Some of the key messages include what we understand, but that the data really reinforces, which is that violence in school settings is gendered. So the VACS findings specific to school settings and school-related perpetrators reinforce our understanding that SRGBV is widespread and that violence in schools is inherently gendered. We need more and better quantitative and qualitative data that capture the array of SRGBV experienced by students in order to guide policy and decision makers, practitioners, and advocates. The VACS here really scratched the surface, and we know that there's a lot more to understand. Next slide. Finally, SRGBV prevention requires a multi-pronged approach, including the development and implementation of strong legal frameworks, evidence-based, locally grounded, and integrated interventions to create safe and accountable school environments, a focus on changing social norms around gender and the acceptability of violence, and finally, recognition of students' agency and their active inclusion in solutions. So now I want to quickly return to Kayleen's point and address the current reality of COVID-19 and the unprecedented interruption of education that's resulted globally with school closures that impact 1.5 billion students, over 90% of enrolled learners. So we know that this will increase existing gaps in access to quality education. For students with access to remote learning, increased time online poses an increased risk of violence. And additionally, I just want to mention an excellent new report from the Malala Fund that drew on data from the Ebola epidemic in Sierra Leone, estimating that approximately 10 million more secondary school-age girls could be out of school after the crisis if dropouts increase by the same rate as a result of COVID-19 that they did from Ebola. Next slide, please. So just noting, I think what we understand, which is that shelter-in-place orders, curfews, and travel bans have intensified the risk of violence against children, and that child and domestic violence helplines have seen massive surges in reporting, while there is also widespread concern about underreporting in many locales. And finally, just to list out some implications for research that we're thinking about. So the first, importantly, reimagining the relationship between violent students in school, research that investigates the relationship between violence in the home, community, and school, and then building on research tools like the VACS that address the connection between violence against women and children's experiences of violence in all settings, including schools. Next slide, please. So very quickly, just to share that there will be a second phase of this research, which will focus on some deep dive analyses in 3 specific countries, and that Together for Girls is also partnering with Global Affairs Canada, CDC, and UNICEF on a Data for Change project that includes secondary analyses of the VACS focused on SRGBV and gendered barriers to girls' education. And finally, further information can be found on our website, including country fact sheets like the one pictured here that summarize the country-specific data. So with that, thank you so much for your attention. I will hand it over to Stephanie Saki, Director of Population Council's Girl Center, to discuss their new evidence for gender and education resource.
Thank you so much, Chrissy. That was fascinating, and I have so many questions and things I look forward to discussing, but now it's probably not the moment, so I will dive into our part. So I just want to say thank you as well to the Global Working Group to End SRGBV for organizing this event. I know it's a challenging time for everyone in all sorts of different ways, and thank you all for making the time to join. So we are very excited to share with you the Evidence for Gender and Education resource, or EGER, which is a new online resource designed to facilitate the use of data and evidence to address gender-related barriers to education globally. And of course, that includes SRGBV. So I'm going to share a quick overview of how we developed the resource and what's included. And then the most exciting part probably is that my colleague Meredith will do a live demo to show you how to navigate the site yourselves and specifically direct you toward information on SRGBV. And then I'll give you just a quick preview of what we're finding related to SRGBV. I want to start by saying that this work reflects an amazing partnership between Echidna Giving and the Girl Center at the Population Council. So for those of you who are not familiar with the Girl Center, we are a global hub of research and thought leadership that generates, synthesizes, and translates evidence to ensure that investments in adolescents and young people, especially girls, are based on rigorous evidence. And next slide. As I mentioned, we've had the pleasure of partnering with Echidna Giving to create EGER. As you may know, Echidna Giving's sole aim as a private funder is to support quality, gender-sensitive education for both girls and boys in lower-income countries. And when we started talking with Echidna Giving about developing this resource, they shared that, like many funders, as well as policymakers, those implementing programs, and researchers, Echidna wants to be sure that the investments they're making are having an impact. So this seems pretty basic and straightforward. Of course, that's what we're all trying to do, but it can be surprisingly difficult to know whether what we're doing is the right thing to do in the right place for the right people. So the motivation of EGER is to drive smarter investments in better evidence-based programming and to build new collaborations to drive progress forward. So even in this webinar, we might be coming at the challenge of SRGBV from different directions, but collectively, our work is focused on expanding opportunities, and core to that vision is making sure that young people have access to high quality education. So as you all know, and I'll go through this very quickly because I'm sure you're familiar with these issues, there's been enormous progress in expanding access to school globally and achieving gender equality. As of 2015, UNESCO declared that gender parity had been achieved in primary and secondary attainment globally. But as you also know, in many places, gender gaps remain and progress in attainment has stagnated. Levels of literacy and numeracy are low, even among young people who attend primary school. And of course, we know that SRGBV is a widespread experience, as Chrissy shared from her data. And of course, new barriers are emerging, as we've all been alluding to. UNESCO has said that school closures in response to COVID are affecting more than 90% of the student population globally. It's hard to even understand and anticipate the new challenges that are going to emerge for this generation of students. So I think these challenges can feel overwhelming, particularly right now, and it can be hard to know the best approach to addressing them. And as we developed this resource, we spoke with many of you about the challenges that you're facing in the work that you do to address these barriers, including SRGBV, and the questions that you would want to answer with a resource like this. So what we heard from funders was that you want to know how to make the best investments with the greatest impact, especially with so many barriers to tackle and new and emerging barriers. We heard from researchers and those implementing programs that you find it challenging to know who is doing what, where, and what the evidence tells us about what works and for whom. And linked with this, policymakers said that they want data that tell them where the problems are greatest and what the best solutions are to addressing those problems. So taken together, what we heard is that there's really a lack of effective coordination and communication across all these different groups. Okay, so we hope that EGER is part of the solution to address some of these challenges. And the goal, as I've said, is to foster connections between organizations and programs, to help identify where needs are greatest, to curate evidence about what works for whom, and to drive smarter investments. So while we know, of course, that no single website can do all of that on its own, we believe that EGER is a critical step on our shared journey to achieving these goals together. So you're probably eager, if you will, to just see the website, and I will hand it over to Meredith in just a minute to walk you through the site and show you how you can learn more about what's happening in the SRGBV space. But first, I want to just quickly give you an overview of the information that's included, because we really would like more input and feedback from all of you. So we focused initially on low and middle income countries, and we're approaching this work from the perspective of three core pillars of information. Where are the needs greatest? What is the current practice? And what is the evidence of what works? So first, in terms of the information of where the needs are greatest, we're drawing largely on Sustainable Development Goal indicators. As you know, and as Chrissy kind of alluded to, there are important data gaps, especially when it comes to SRGBV. So we're constrained if we don't know what the problem is and where to address it. It makes it difficult to know how to best meet needs. We've mapped who is doing what and where in global gender and education. And to do that, we've initially focused on organizations that meet three criteria. They work in more than one country. They have an annual operating budget of about $1 million US, and they work to address gender and education, which we've defined broadly to capture any work that might address gender-related barriers. So that includes SRGBV. It also includes violence at home, for example. So the third pillar of information is evidence of what works, and that evidence comes from existing literature as well as a new systematic review that we're finalizing now. Next slide. So I could spend this entire time talking about how we know about evidence of what works, and there are certainly different views on this. But in terms of existing evidence, what we're doing right now is pulling in results from recent systematic reviews and rating the strength of the evidence for each approach and outcome pair. For example, do programs designed to address SRGBV using different approaches improve absenteeism levels in schools. So we're also addressing gaps in the evidence through a new systematic review that's looking specifically at interventions designed to address gender-related barriers to schooling. The full results from that review will be out in the coming months, but some preliminary findings are included in the site, including findings related to SRGBV. In both cases, the existing evidence and new evidence, we've tried to maintain rigorous standards of evidence, which also means that results from individual studies or the gray literature are not fully represented here, but we're looking forward to engaging in a discussion, and we're already in that discussion, about ways to keep building on this work going forward. So in designing our systematic review, we had to put together a framework outlining perceived gender-related barriers to schooling based on work that has come from many of your organizations. And we're thinking about these perceived barriers in terms of how they impact 3 levels: the community, the school, and the household. Of course, we all know that these levels are very closely related. Chrissy was just thinking about how violence in school and violence at home are connected. So for example, if you look at these different areas at the school level, school-related gender-based violence is the last one on the list. Again, it's connected to things like poor policy and legal environments and pedagogical practices, which are other barriers included here. So I'm happy to turn it over to my colleague Meredith, who's going to walk you through the live site so that you can explore on your own. And as you explore on your own, please bear in mind that the site is live, but it's still a work in progress. We wanted to soft launch the site over the last few weeks to give you a chance to interact with it and share feedback while we continue to add data and fix bugs here and there. And we really would love your input on additional programs or organizations that are missing or incomplete. So with that, I will turn it over to Meredith.
Thanks, Stephanie. If we go to the next slide really quickly. If you'd like to follow along in our live demonstration, please feel free to enter the URL at the bottom of your screen, www.egerresource.org, into your internet browser, and you can follow along with us. So with that, I'm just going to share my screen really quickly. And I hope everyone can see this pretty well. Okay, wonderful. Well, welcome to EGER, everyone. We're very excited to have you here. As Stephanie mentioned, this resource brings 3 different kinds of data together to provide a 360-degree view of the gender and education space. EGER is composed of 3 distinct yet interconnected parts: the profiles, data visualizations, and our evidence to practice tool. But to get to know the resource better, let's start with the building blocks of EGER, the profiles. Users can find details on over 250 organizations and 500 programs that are currently active in the gender and education space. We are always adding new profiles, so check back often. You can peruse the list of profiles here or search for a specific organization to find out more. The organizational profiles provide general information regarding who this organization is in the gender and education space. This green check next to the organization name means that the information has been verified by the organization itself. If there is no check mark, the profile contains data we've extracted from publicly available websites and materials. From an organization's profile, a user can get a better sense of this organization's areas of work, any partners or funders an organization may collaborate with, background information on this particular organization, and any current girls' education activity this organization is affiliated with. If you'd like to explore a particular program further, click on any of the projects listed here. And this is the program profile. As you can see, similar to the organizational profiles, users can find details on a specific gender and education program, including what topics the program addresses, who the program is targeted towards, and what approaches are being used to reach this program's particular goals. But let's say you'd like to explore what's happening in the gender and education space from a bird's eye view. You can head to our data visualizations page to explore who's doing what and where through our table and map visualizations. Choose the table builder to get a curated list of organizations and programs. If you know what you're looking for, you can create your own table by selecting the parameters here. So you can filter the programs to target specific programs and interests. Or if you'd like to simply explore the database, select one of our preset table questions here on the left. And voila, your table is generated. You can always refine or expand your table by using the Adjust Results menu here. In the future, users will be able to download the results into an Excel or CSV file. While the table provides a great way to explore who's doing what in the gender and education space, perhaps you're more interested in where these activities are being implemented and how that compares to needs on the ground. That's where the map visualization comes in handy. Similar to the table, the map builder allows you to explore a preset map or create your own by filtering programs based on the parameters set here. So if we're interested in school-related gender-based violence, you can scroll down to find that here and select that parameter here. You can also shade your map based on select needs indicators, which use Sustainable Development Indicator data located here. And then you can create your map. Once your map is generated, you can explore the programs and activities taking place in a particular country, region, or at the global level. Each program on the map is represented using a small marker. The green circles with the numbers in the middle are consolidated program markers for programs taking place at the country level. Click on any program marker to find more information about a particular program, as well as a link to its program profile. You can also check out programs taking place at a global level by clicking on the blue circle here. Or if you're more interested in regional level programs, those are represented by the purple circles. The last element of EGER is the Evidence to Practice tool. This tool takes research evidence from diverse disciplines and distills complex results into simple to use messages on what works in gender and education. In this tool, you can explore which approaches are most effective to achieve a specific outcome, or if you're already using a specific approach and you'd like to see which outcomes that approach affects, you can search the outcomes. So say we'd like to know what approaches work to improve girls' literacy. You can select Increase Literacy from the Outcome drop-down menu, and then View Results. EGER then shows a list of hypothesized approaches, as well as a level of evidence for the association between these approaches and our selected outcome. It also reveals where data are available and the level of evidence disaggregated for girls and for boys. Expanding a row provides links to the research that the evidence is drawn from. You can click on any of the research tiles to see a summary of a particular study. To learn more about EGER, please explore our About page. Here you can learn more about the different aspects of the web portal and how EGER is created. Or if you'd like to get regular EGER updates, head to our Join Us page, where you can join our mailing list or send us suggestions for how we can make this the most useful resource for the gender and education community. And with that, I'll hand it back to Stephanie to share some of our preliminary findings from using EGER.
Thanks, Meredith. So I'll just take 2 minutes to kind of preview for you how we're thinking about and looking at SRGBV in here, and then we really invite you to go in and check out this site and let us know what we're missing and what we can add. Next slide. So, you know, another caveat, which is just to say that, of course, the field is organic and will undoubtedly continue to grow and shift. And we hope that EGER will reflect those changes. But again, that depends on inputs from all of you and from those of us working in the field. But just to give you a quick glimpse, as I mentioned earlier, one of the exciting insights offered by EGER is this understanding of the alignment or the lack of alignment between these 3 core areas. Where are the needs greatest? Where are the programs happening? And where do we have evidence of what works? So let me just give one example from our work on SRGBV. So Meredith showed you that if you use the map builder, you can arrive at this map, which shows the layout of where current practice is in SRGBV. And this reflects organizations that identify programs that they're implementing that are working on school-related gender-based violence. Next slide. And here's the same information in the table view, which Meredith showed you. So if you switch, you can see the list of different programs, the types of programs, and the organization implementing them, as well as the country where they're taking place. So to distill this information a bit, we can see that in the database right now, there are 159 organizations that describe work that is designed to address SRGBV. And there are more than 80 individual programs that are currently active and that are aiming in part to address SRGBV. While there are several funding streams directed at SRGBV, it's hardly a saturated area. But when we look at the evidence side, and part of this is coming from our current ongoing, almost complete systematic review, and we know that while the evidence has grown in recent years, those evaluations have not looked at the effects of programs designed to address SRGBV on education outcomes. They have looked at the effects of those programs on violence outcomes. Now, we might decide as a field that it's sufficient to know that programs reduce violence, and certainly that represents progress. And we may suspect from many other types of data that reducing violence will lead to improvements in education in the long term. But right now, what the picture tells us from the evidence to practice tool is that we don't actually know whether these programs designed to address SRGBV are improving education outcomes. And I think it's worth asking ourselves as a field whether that's information we should have, and if so, how to get it, particularly when we look at how many organizations and programs are currently active in this space. So as Meredith showed you on the program side, there are a lot of ways to drill down to get more information. You can customize these tables and the map any way that suits your interests and needs. Next slide. So if you refine the programs to get more information about what the approaches are, we see that, for example, of the 81 SRGBV programs, 12 are programs that work with school personnel, and 3 of those programs are taking place in sub-Saharan Africa. And on the organization side, of the 159 organizations working to address SRGBV, 78 of those are in part undertaking networking activities, and 45 of those are taking place in sub-Saharan Africa. So again, we invite you to check out this resource, explore it yourselves, and please share feedback. There's information on how to do that on the Join Us page that Meredith showed you, or of course you can reach out to us directly. And I'll just end by saying that we're working to synthesize all this valuable data across the needs, practice, and evidence spaces to share recommendations on how to accelerate progress in the future to improve gender equality in education. So toward that end, we'll be releasing a 2020 Gender and Education Roadmap this fall that will identify specific gaps and opportunities for investment. But we have this lead up period right now of several months to open up to feedback and input from all of you to make sure that this resource is as valuable as possible, and that the way that we're characterizing and describing these gaps and opportunities aligns with how you see progress in the field. So again, we invite your input and feedback. With that, I will turn it over to Shirley to hear more about the fascinating work that you all have been doing in Zimbabwe.
Thank you very much. And I would like to thank the Global Working Group, Kayleen and Taku, and for their work in organizing this webinar today. It's my pleasure to be able to share with you some of the findings and the ways in which FAWE Zimbabwe, Miske Witt Associates International, and UNGAI have been working together to use data from the pilot on SRGBV prevention in Zimbabwe. The findings here are distilled from a 40-page baseline report with over 80 pages of indices. So I'll be giving a very brief background to the pilot. I'll give an overview of its research foundation, the whole school approach, the partners, the data collection instruments, key findings, and finally using baseline findings to guide the next steps in prevention and response. After the convening of the Global Working Group in 2014, Jenny Parks and her colleagues from the University College of London, the Institute of Education, prepared a rigorous review of global research evidence on SRGBV in 2016. Building on this review, the Global Working Group and Ungai developed the document you see on the left, A Whole School Approach to Prevent SRGBV, a guidance document with which many of you are very familiar, which offers guidance to policymakers and practitioners in designing a school violence prevention program and strengthening response actions. The graphic on the right of the screen shows the 8 domains of the whole school approach, several that will be mentioned today, including effective leadership and community involvement, codes of conduct and school rules, and addressing incidents of violence and improving reporting. An effective whole school approach includes collecting and using evidence from these domains to enable school stakeholders to come to a shared understanding of SRGBV and then to change harmful patterns of behavior over time. The approach targets SRGBV drivers that perpetuate or drive harmful actions. Some illustrative drivers of SRGBV include rigid gender roles, stereotyped constructions of femininity and masculinity, the normalization of violence against children, silence around violence of women and girls, socioeconomic inequality and discrimination, and weak implementation of institutional frameworks, laws, and policies. The purpose of this pilot is to test the theory of change for a whole school approach. The theory of change states if the drivers of SRGBV are identified in context, and if interventions based on the minimum standards are designed to address these drivers, these interventions will contribute to an enhanced system of reporting and response and to a decreased tolerance of violence, and it will decrease the prevalence of SRGBV in the long term. The central evaluation questions to help us understand if this theory of change is, if it works, include what is the status of stakeholder knowledge, attitudes, and behaviors related to the drivers of SRGBV, with a sub-question, how do these things differ by stakeholder group, students, teachers, and others, by gender, and by primary versus secondary? And how do they shift or change over time? We'll ask at the end line. And the second question is, in what ways do the 10 schools support or not support the minimum standards of the whole school approach? Whether and how do schools shift or change in supporting the standards as they participate in SRGBV programming will be asked at the end line. To carry out the pilot, VAWE Zimbabwe is the national implementation partner. Miske Witt Associates International is the learning and evaluation partner. From the outset, it was clear that as partners, together with Ungai, we would not operate independently, but collaborate and support each other. We began by developing a joint work plan, identifying who would lead and who would support on each activity. VAWE began by building on its relationships with Zimbabwe's Ministry of Primary and Secondary Education, or MOPSI, with its Department of Learner Welfare Services, to request identification of 2 districts. They identified Chitungwiza and Shamva for the pilot, and district school inspectors and local stakeholders in these 2 districts identified 5 schools in each as pilot schools, based on the school's high incidences of learner welfare issues and reported or suspected cases of SRGBV at these schools. In 2019, in June and July, VAWE and Miske Witt collaborated on school visioning workshops. They introduced the whole school approach and built consensus for the project with stakeholders from the 10 schools, and Miske Witt collected data together with VAWE. Then Miske Witt designed and conducted the baseline study with VAWE participation in the data collection. This was before any activities began, and Miske Witt proceeded with the data analysis and write-up with input from Ungai and VAWE to the draft report that was prepared in December of 2019. Simultaneously, materials development was going on for future workshops with collaboration there, and VAWE led the Preventing SRGBV workshops for teachers in September and October. Since this was a mixed method study, both quantitative and qualitative data were collected. The left-hand column of the chart lists the instruments, 3 qualitative and 4 quantitative. The surveys included items on the drivers of SRGBV and items related to the minimum standards of the 8 domains. Using tablets for these surveys increased the interest in people conducting, in people using or filling out the surveys. We then proceeded with the analysis, and I'm going to save a discussion of that analysis for another occasion and move into what the findings were. Starting broadly with gender norms as drivers of SRGBV. Gender norms, defined by UNICEF, are ideas about how girls and women, boys and men should be and act. Internalized early in life, they can establish a cycle of gender socialization and stereotyping. The results here and for each of the following drivers and areas the results are shown according to the following general pattern. The findings in red and orange highlight areas for improvement where stakeholders' views about women and men or girls and boys are not equitable and can lead to ongoing violence. And findings in blue and green highlight areas where schools are meeting the minimum standards or where stakeholders have more equitable views. With regard to roles of men and women, stakeholders thought that both boys and girls should be educated and should share household chores. They also held more traditional views regarding, for example, women's and men's roles in the family. They agreed that a woman's role is taking care of the family. In general, girls and women held more equitable views regarding social norms, attitudes, and policies than boys and men. And adults held more equitable views regarding social norms, attitudes, and policies than compared to learners. Boys and men's attitudes and beliefs were that they were entitled to have more benefits and more power than girls and women. Though this finding is not surprising to those of you listening to the webinar, this provides data in context to share with stakeholders to allow them to reflect on these inequalities and to consider them and their relationship to everyday life and to schooling. The findings in relation to beliefs, attitudes, and behaviors related to violence that perpetuate or that drive SRGBV, again using a similar color scale and charts related to results, that charts the results related to gender-based violence, stakeholders all disagreed with violence against women at home, and yet they accepted violence against children at home and at school, the corporal punishment, and they considered violence to be normal. This normalization of violence, together with what we're seeing as a lack of clear laws and policies for reporting violence, led to no one talking about violence or the silencing of violence. The inconsistencies regarding corporal punishment and hitting children is key here. 52% of the visioning workshop respondents reported that teachers punish students by caning or hitting them, and more learners agreed to that than did adults. And 40% agreed that it's all right for teachers to hit learners if they're late for school, with primary students, adults, and women agreeing more, even though the laws prohibit the practice now. Teachers interviewed were aware of the policy forbidding corporal punishment, and they were also familiar with the ministry guidelines prescribing when and how corporal punishment should be administered. So an inconsistency regarding this law and policy and practice is key. Key findings in the domains show us how the mixed methods aspect of the study is critical. The domains we're discussing here look at the school rules and codes of conduct and school leadership and community engagement. We found discrepancies in what stakeholders reported via surveys and what data collectors observed and heard from interviews and focus groups. Stakeholders agreed that school rules included SRGBV, and all schools reported active school development committees working toward SRGBV prevention. However, from the 10 schools, none of the physical copies of the school rules we looked at clearly defined SRGBV or violence. The whole school approach clearly needs to be continuing to look at these, looking at this aspect of what's going on in schools. In order for the whole school approach to be effective, it needs to align with national policies, and its school codes of conduct and rules need to align with these national policies and district policies as well. The government of Zimbabwe has laws and policies to prevent gender-based violence, including the Zimbabwe National Gender-Based Strategy, the National Girls, Young Women's Empowerment Framework, and others. And the Ministry of Education, the Ministry of Primary and Secondary Education circulars are also related to SRGBV. From 2018, we have the implementation guidelines for the institutionalization of the guidance and counseling programs in all primary and secondary schools. And prior to that, the compulsory establishment of child abuse prevention and management reporting structures at every educational institution under the purview of the ministry. While these policies exist, there's also, according to the research, according to the study, weak implementation. Some of the laws and policies for reporting violence are unclear according to the stakeholders. The reporting mechanisms and processes vary from school to school. There's a lack of clarity on reporting and a lack of follow-up. Policies have inconsistencies, for example, such as corporal punishment that I just described. With this array of findings, how are the baseline findings being used to guide the next steps in prevention and response? This is really at the heart of the presentation. First, VACS used the findings to steer its 2020 implementation in February and March of this year, sharing findings with stakeholders and policy implementers. They used some of the findings with group discussions. They broke the groups into the officials into small groups and had them discuss some of these findings. And they also used them to share the information with officials at various levels. Miske Witt provided supporting materials, a 3-page summary, a 1-page summary, and PowerPoint presentations to share the findings. VACS is going to continue to work with the 10 pilot schools on the minimum standards and school stakeholder SRGBV prevention plans as allowed by COVID-19 and the crisis. They'll continue to work with the pilot schools in these ways, developing a shared comprehensive definition of SRGBV, encouraging the development of this with school stakeholders, developing codes of conduct and school rules, including this comprehensive shared definition, and strengthening working groups for SRGBV prevention at the school level. How has the COVID-19 pandemic affected the work of the pilot? Schools were closed in Zimbabwe on the 24th of March, a week before the actual last date of the term, for the first term for 2020. The opening date for term 2 is the 5th of May, but citizens are not yet sure whether this will be followed. UNGAI and UNICEF have shared resources that have been prepared for this time of the pandemic with VACS to share with the Ministry of Education. VACS has issued its own statement that's on its website with regard to how it is responding to the pandemic. If possible, they will continue to work with, to expand the initiative with leaders in the 2 districts through 2020 on the whole school minimum standards. They had invited all of the head teachers from one district, from each of the districts together to a meeting, not only working with the pilot schools, but then expanding it to the entire district. They also plan to work with partners and the ministry at various levels on policy coherence and alignment with practice in schools as possible, for example, on attitudes toward and practices of corporal punishment. So if we return to the theory of change, if the drivers of SRGBV are identified in context, and if minimum standards are designed to address these drivers, these interventions will contribute to an enhanced system of reporting, etc. At this point, we've completed the first 2 clauses. The pilot has identified the drivers of SRGBV in context and is working on the minimum standards-based interventions to address these drivers, working with the schools as they develop their own action plans and so forth. One thing we've realized is not in the theory of change that is critical, and that is if school communities develop shared definitions of and understandings of SRGBV. Since we have a difference in what people are reporting as SRGBV, the number of incidences that are different that they're reporting, and the different definitions, there needs to be this agreement at the forefront and at the beginning of the work. So we're off to a strong start. This was conceived of as a 2.5-year intervention, however. For various reasons, it's been reduced to a 1 year. So it's important to ask what's realistic to expect at the end of the first year. First of all, the baseline was conducted in September 2019. The end line probably will not be able to be, or may not be able to be conducted in September 2020. It may be delayed until 2021 so that there is more time for the interventions to be implemented in the schools by the various stakeholder groups. But we've ended up with a complex set of baseline findings that differ by gender, by age, and grade level. It suggests that schools will need to refine their work refine the work and work with the schools on refining the action plans. Especially in primary, we need to work with the learners who think that it's okay for their rights to be violated and okay to be beaten, working on the empowerment of child rights. And VACS, subsequent to this baseline, has introduced a learner-led Tuseme program so that students are, in fact, together with teachers, working on looking at these issues and matters of SRGBV. Given the low rates of disclosure reporting that Together for Girls told us about, although we don't have this data for Zimbabwe, we can anticipate that increasing the rates of disclosure on SRGBV will be very difficult to get, and we'll need to focus on this much more than what is appropriate in context. The guidelines suggest that in 1 to 5 years it will take for a school to become address school-related gender-based violence appropriately. However, given the challenges that we see, the multiple challenges in the context and depending on resources, I would speculate at this point that we should be thinking of at least 5 years and continue to be thinking about ways in which we can continue to collect the data to follow 1 year at a time how this pilot is rolling out in terms of developing this very promising whole school approach. Thank you.
Thank you so much. A huge thank you to all of our panelists today. I found it fascinating to kind of start with Together for Girls, looking at the cross-country analysis of prevalence trends and the gender differences. And then with each presentation, we kind of dug a little deeper of those different drivers contributing towards this prevalence of violence, as well as the effectiveness of certain interventions to prevent this violence. So I know I'm really looking forward to further exploring the Together for Girls and EGER website and to reading the full Zimbabwe baseline report. But with that, I want to turn to our Q&A session. We have some questions that have already come in that I'll go to, but also folks, please continue to enter any questions in the box now. So the first, I think there's a couple questions for Chrissy. We have one from Jess Atkinson asking about if you disaggregated the data by any other factors besides gender, for example, disability or socioeconomic status. There was also a question about how countries were chosen for VACS analysis to be implemented. So I'll open that up to Chrissy first.
Great. Yeah, those are two excellent questions. So in terms of disaggregation, the only other factor by which we disaggregated the data for these secondary analyses was just separating out respondents to the survey who had ever attended school and excluding those non-respondents. And so, no, we weren't able to look at socioeconomic status and to disaggregate by that, I think likely as a result of the sample size. But for the second round of analysis that we're currently undertaking, and this will be a deep dive in Cote d'Ivoire and likely Kenya and Nigeria. And Cote d'Ivoire and Kenya are both very, very recent surveys, which is exciting. But we hope to triangulate some of the existing findings with other data sets, which may include more information around, socioeconomic status, ethnographic data, and even potentially looking at actual education investments and how that correlates to rates of violence actually at the subnational level. But yeah, it's a great question. And then in the VACS are, how VACS countries are selected, just to share briefly, the sort of origin story of the VACS is really work that was done in Eswatini over a decade ago by CDC and UNICEF to really to create a survey mechanism to understand the relationship between gender-based violence as a driver transmission among adolescent girls and their disproportionately high HIV infection. And so as a result, the vast majority of the VACS in sub-Saharan Africa, where most of the VACS have been conducted, are funded through PEPFAR, the President's Emergency Plan for AIDS Relief. However, some of the VACS, for instance, the ones that have been conducted in the Northern Triangle, are supported by USAID in collaboration with the International Organization for Migration. And just to say, in all the sub-Saharan VACS, there's a separate module on HIV, both in terms of status and risk, et cetera. And then In the Northern Triangle, for instance, there were specific modules developed around community violence and migration to understand the interplay of those dynamics with VACS. So certainly we'd like to do them in lots of places, but the funding is a driver, and continue to explore different partners to implement VACS in different countries.
Great, thanks, Chrissy. Now I think for Stephanie and Meredith, there's a question about if there were any findings related to violence against girls on the way to school. Like, for example, what percentage of girls, boys experience violence on the way to the school? So I don't know if you could speak maybe to how that's represented on the EGER resource, but also maybe in your new systematic review.
Sure. I think Chrissy might be better able to answer that from the VACS data, but in terms of how you can look at this in EGER, a couple of things. As I mentioned, we're using the SDG indicators right now to overlay with the map view so that you can look, for example, at the countries where the highest proportion of students report that they've experienced bullying in school, and then the countries where there are SRGBV programs designed to address SRGBV. But really there are data limitations, and I'm wondering if we can somehow integrate the VACS data because it seems very valuable. So right now we don't have a separate indicator in there about violence experienced on the way to school, but would love Chrissy's thoughts on the best way to integrate that. In terms of our systematic review, we searched for and included any evaluations of interventions designed to address school-related gender-based violence, and that includes interventions designed to address violence on the way to school as well as in school. I would say that generally speaking, it's the same interventions that try to tackle these different barriers. So individual studies might have estimates of what's happening in terms of violence on the way to school versus in school. But as I said, none of the evaluations that we found estimated the impacts on education outcomes. So that's not to say that there are no effects, it's just to say that we don't have data on it. So that might be not too satisfying for the asker of that question. I don't know, Chrissy, if you have anything to add on that topic.
Yeah, this is such a good question. Unfortunately, the VACS do ask lots of questions about the location of violence, but not specifically whether it's on the way to school. The question is really posed whether it happens on a road or a path, but we're just not able to disaggregate it to understand if there's a relationship between the road and the school, for instance. But yeah, that's certainly a critical question for further research.
Great. I'll just go back to Stephanie. There's a question about when the systematic review and 2020 Gender and Education Roadmap you mentioned would be available.
Yeah, great question. So for the systematic review, the protocol was submitted to the Campbell Collaboration and approved before we started the review, and then the report will be submitted to them in the coming weeks for peer review and approval, and then publication online. So we're hoping that that will happen by the end of the summer, but we are, the summer in the US, so August, but we are sharing preliminary findings through the EGER website right now, and you can see that if you can either look at the study profile of our systematic review protocol, which is published online, or you can search by certain types of approaches that are included in our review, and our preliminary findings will show up. So we're trying to be as transparent about those results as we go through the peer review process. And then hopefully it will be published in different journals. But once the report is published online, it's publicly available. And the roadmap, as everyone can imagine, the plans are evolving in response to the current COVID-19 situation, but our plan was to share it and disseminate it in October. So I think we probably will have the same timing, and perhaps it will be more virtual dissemination than in-person dissemination. And then it will really be a kind of living document that we hope to update every couple of years or so.
Great. We do have about 2 minutes left, so I'm going to take one more question, but I might also ask the panelists if they wouldn't mind sharing their email address in case there's any other follow-up questions or something more specific that folks want to touch base on. So this last question I'll give to Shirley. There's a request to elaborate a bit more on the 1 to 5 years to address SRGBV. For example, might this be a SRGBV turnaround window?
Thank you for the question, and thank you, Margaret. In particular, Margaret worked with us on the foundations of this project, and I'm sure is excited to see how it's moving along. The 1 to 5 years grows out of the report, the guidance note, and I'm not sure if that grows out of particular studies that have been done already, although we know that the existing data is slim and that this is a new approach being tried. So it may well have to do with knowledge from the north that we know about schools changing and improving students' academic performance in 1 to 5 years. It could be from other resources as well. I think it's not yet, since this is just a pilot, we're just beginning to think about how long will it take to do these different things. And I think we'll be coming up with a list of factors such as it will depend on what structures are in place to support this kind of work, what laws are in place, what's the willingness, the political will to support this, not only with laws, but actions and implementation, the kinds of materials that are available. For example, in our rural Shamba district, teachers were not familiar with the word gender. So if there's that lack of awareness and starting at that point, then how does one move along from there in order to build this understanding? Actually, one can move quite quickly, but we don't yet have information on how long that takes. So we'll be following it closely, following VACS as they continue, and look forward to hearing about more pilots that are going on about this as well. Thanks.
Great, thanks Shirley. And I think with that, we're gonna have to wrap up, but I wanted to just again thank my colleagues at Ungai, Gloria, Jada, Taku. You guys were instrumental at pulling this together and ensuring that it was smooth sailing with no technical issues. So thanks for that. And thank you to all the panelists and all of the participants for your very thoughtful questions. We hope everyone has a great rest of your day.
Thanks, everyone.
Thank
Bye.
you.
Thanks, everyone.